they're going to stimulate my brain with magnets. I've heard a couple of different things about that. I heard it's like, so it's very new, very clinical trials. It's like guinea pig type stuff. I think it's approved for depression.
Yeah, so right now they do use transcranial magnetic stimulation to treat depression, but I think the enrollment that you did is to study how you learn, right? From the link that you sent me. So the study is looking at certain components of how you retain information, learn new things, and they're using transcranial magnetic stimulation to see if they can influence that.
Oh, okay. I didn't read that far into it.
Travis signed up pretty impulsively here.
Hey, the motorcycle racer that crashed going 130 miles an hour. I like to let's rock and roll, let's go. I don't read things. Let's do it.
I think you saw brain and research and just gave all your information.
Yeah.
Sign me up.
Sign me up. Let's do it.
Yeah.
I want to dedicate myself to learning new things about the brain.
Yeah. And then if you get through some of the initial phases, they'll give you more details about it. So you'll learn a little bit more about what they'll be studying, what they'll be collecting from you, what they'll be doing as the intervention, which will be TMS in this one.
TMS. Yep. Yeah. And they're also doing other clinical trials that I haven't signed up for, and that's the hyperbaric oxygen, the over oxygen saturation.
So you signed up for a hyperbaric study?
So I didn't, but
you saw what was going on.
Yeah.
That one, I wouldn't be surprised if, based on your application, if they selected you for the hyperbaric, because they're doing a lot of research now about post-concussion hyperbaric treatment.
Gotcha. Yeah. I would be definitely interested in that. As a matter of fact, where I work, we have a hyperbaric chamber.
Why?
There's a deep pond that we dive in sometimes. We're used to.
Wait, why do you have the hyperbaric chamber?
Just in case we need to be recompressed to a depth.
Really?
Yeah.
That is a deep pond then.
It is.
That's like deep. Scuba diving deep.
It is. Yeah.
Do you ever go down there?
I've been down there.
Like in a submarine?
Not in a submarine. There's been submarines in there, but
that's fascinating.
Not big submarines. I don't think people could. I can't say too much about it.
Okay. Well, did you know that the one that was in the news recently, not recently, probably a year ago, about the submersible that went down to the Titanic?
Oh, yeah.
And used a carbon fiber hull and then just, kept hearing the pinging and then eventually imploded.
Look, as soon as I would have seen. So from doing the things that I do, I know that I definitely would not have went down on that submarine until it had been tested to the point of failure, to where I was like, okay, yep, that is the point.
You got to know the threshold, right?
You got to know the threshold.
Yeah. There's a documentary about it.
About the Titan submersible.
Yeah, with Stockton Rush and all the testing that they did and the scientists that expressed concern. You actually might find that interesting from a testing protocols perspective.
Yeah, I would definitely watch it. And look, I'll race motorcycles, but I'm telling you what, I would never get in something that's going underwater that you had to bolt shut. You need a way of escape.
Well, at those depths, is there a possibility to escape?
Definitely not. If
they're on their way down and something goes wrong.
Or if they get you back to the surface, there's just so many things that could go wrong there.
Yeah.
So there are so many things.
Yeah. So your use of hyperbaric is if somebody is down at increased depth and then they need to reacclimate to oxygen concentration at
right. Do you know how that stuff works with when you dive and you're breathing in compressed air?
No, tell me about that.
Okay, cool. So basically you're breathing in, it's mostly nitrogen that we're breathing in now, and it's oxygen and some carbon dioxide and, different little, very little carbon dioxide and a bunch of different gases. Mostly it's nitrogen. Mm-hmm. And say at the surface level, every time we breathe in this much oxygen or this much nitrogen. Okay. When you go underwater and every 33 feet that you go down, you are essentially under another atmosphere of pressure. So that amount of nitrogen will get this smaller when it's compressed. Just you're being compressed too. Everything's kind of being compressed. And then you're 60 and 90 feet. And eventually this amount of oxygen
or nitrogen,
sorry, gets compressed down to like minuscule.
Okay.
But when you breathe in, you still breathe in all of that nitrogen. So you breathe in a lot more nitrogen when you're at depth. Like say 10 times more than you would breathe up here. So when you come back up, what happens is your body has to expel that nitrogen. If you don't, it's like taking a soda bottle, shaking the soda bottle up and just opening the lid real fast, and it just explodes everywhere. That is essentially what happens to the gases in your body, and they kind of go through your blood or your brain or wherever they end up, and that's like known as the bends. So basically, you have to do a like decompression as you're rising. So you have to come up very slowly, and you have to stop, and then that all depends on like how long you're down there and how much of the air you breathe. It's like there's a lot, like how much you weigh and a whole bunch of different stuff.
And when they're down there, are they breathing just concentrated oxygen?
No. So if you breathe oxygen at depth, it's basically poison.
How about that?
So you want to breathe like smaller amounts of oxygen.
Okay, so that's all calibrated to whatever's appropriate at that depth. And then when they come back up, sometimes you use hyperbaric to help them acclimate.
So if they have to come back up to the top very fast for a emergency, you get put into the hyperbaric chamber, and what they do is they take you back down to those depths that you were just at, and then they bring you up slow.
Interesting. So is that why they make such a big deal that when somebody's coming up from a dive that they have to like get out of their suit right away, in terms of like how they acclimate out of that? Is there compression forces still, or dilution of nitrogen still a factor?
It depends on like the depth that they were at. But
okay.
Usually, typically, the getting out of the suit, like you don't have to get out of the suit. You can just stay in it.
Okay. And then they just control the air around you.
Yeah. And then you get into the hyperbaric chamber and they just crank it on and it puts you back down to whatever depth, 120
I've never been scuba diving. Have you?
Yes, several times. I'm actually a rescue diver.
You're a rescue diver?
Yeah.
Like Navy rescue diver?
Well, like SCSI.
So what does that mean?
Oh, that's just it's like there's like different scuba organizations like PADI and.
So what does a rescue diver mean? Like what are you qualified to do?
I can rescue somebody
who's diving. So what's a reasonable depth? 100 feet?
That's a little deep for around here.
Okay, so like 80 feet, 50 feet,
50, 40 feet.
Okay, so somebody's at 40 or 50 feet and something goes wrong with their air supply. You would be the one to go down to bring them back up?
I could be if I was needed to be. I know what to do.
Okay. What are some other scenarios in which you would need to go rescue somebody?
If you've seen somebody, so what you would do is typically you have a team of people that you're diving with, and you always have like a dive buddy, right? And you always want them like within arm's reach in case you run out of air. And there's different signs for like if you run out of air. Well, there's actually just one sign, and it's like this, like I'm out of air. That's out of air.
Because you can't move your arms fast when you're underwater.
Well, you can, yeah. You can move pretty fast, yeah.
Okay. But I guess you don't want too many signals so they don't get mixed up.
Right. And they'll go over all these different signals when you're getting your scuba license. But so I just went a little bit farther than, just normal, typical open water diver. I got the rescue certification. First thing that they teach you in rescue diving is do not become a victim yourself.
What's the most common scenario which that would happen?
Somebody's drowning and they're like flailing all around and you swim over to them. Do not do that.
So what do you do?
So I'll tell you the first time I tried this, like, cause they're like, I have my mask on and my regulator in my mouth and I swim over to the guy, like, and he knows what's going on, right? Like he's pretending to be struggling. And I get over to him and I'm like, hey man, I got you. And he jumps on top of me and grabs my head, knocks my mask off, knocks my regulator out of my mouth, and I'm underwater in like 2 seconds. No air, underwater. I was like, oh,
that's
gosh.
Terrifying.
Yeah, happened just like that. Don't ever go near anybody that's drowning.
So they did that to teach you a lesson?
Yeah, well, yeah.
So it taught me a lesson. What do you do instead?
So one of the best ways is you get their attention. And when they're coming towards you, you just swim backwards towards land, and they'll keep coming after you. And
But they're running out of air.
well,
Is that like that's what drowning would be in diving, right? Running out
so
of air.
that could be just like anybody, like just like a regular
Oh,
swimmer.
you're talking about like even at the surface.
Even that's at the surface.
I
Yeah,
gotcha. I
yeah.
gotcha. And as a diver, you don't have like a throwaway. So like typically, if you're out on the water and somebody's drowning, you throw them something.
Yeah, that would be what you
Hold
wanted to do.
themselves.
You wanted to you want to give them something other than you.
Yeah. Yeah.
But
Otherwise, there's two victims.
otherwise, there's two victims. Yeah.
As a rescue diver, are you certified to go find people that have drowned?
So I mean, yeah, I haven't
You're
done
a
that.
jack of all trades.
I haven't done that in a very long time, and I wouldn't I know what to do, but don't be calling me to go rescue anybody right
Call the
now.
Coast Guard.
It's been a long time. It's been a long time.
Yeah.
And I actually have there at work. There was actually 3 people who died in that pond, and I was there for one.
Oh my gosh.
Oh yeah, it was bad. He was a very good dude. I knew him.
Oh my
Yeah.
gosh.
Yeah, and another good friend of mine was his dive buddy when it happened. Yeah,
Wow.
it was very sad.
I bet that's a really risky thing to do.
It is very risky.
Especially.
Why do I do all these risky things?
I was going to ask when you first got into scuba diving.
So it was it was kind of required for this
For your position.
this thing I was doing.
Cool experiences out of it.
Yeah.
Have you ever gone scuba diving for fun?
Yeah.
Where?
So there's a place called Dutch Springs in it's like PA.
Okay.
Hershey, PA.
Okay.
It's pretty cool.
Okay.
Like it's super clear. Most places around here though are not clear. And it's cold.
Mm-hmm.
Yeah, kind of
yeah, you'd have to go someplace tropical.
Yeah.
But then you have to be careful of when you fly back. So
that's right. You do.
Travis is now enrolled in a study that could potentially get him tied into a study for hyperbaric. But in the meantime, he'll wait to hear about his TMS study.
Transcranial magnetic stimulation.
Yeah.
Yeah.
I'm excited for you to just be a part of the research process.
Yeah. Well, you know what? We're going to continue to update.
Yeah.
We'll keep updating people, and maybe we'll get some of those guys to come on our podcast.
Yeah. And you'll be the firsthand experience of science sometimes can be slow.
Yeah.
So it might be a couple months till we have an update.
Yeah. And funny enough, I was talking to Dr. Silverstein, and he was telling me now that there's these blood biomarkers that they found 10 or 15 years ago that are basically that he wants to test me for now that depicts or that gives a good sign of the progression of MS. Like, how is it going to progress?
So they can find out your prognosis based on a blood biomarker.
Right. And then they found that out 15 years ago. And I said, you know what?
Wow.
I said, we just talked about this last couple weeks ago. I said, it takes, anywhere from 10 to 17 years for medical research to actually reach the medical community.
Practice, yeah.
And he finished my sentence when I was saying that. I was like, you're perfect.
Yeah.
Come on our podcast.
So Dr. Silverstein will be joining us to be able to hear his insight. And I think he's going to have a lot of really neat things to say because he understands a lot of the nervous system that has a lot to do with concussions.
Mm-hmm.
He understands how nerves communicate with each other, how they have to be insulated, what happens when that insulation becomes compromised. So I think we'll have a pretty cool discussion about that.
Yeah. He is actually a multiple sclerosis doctor, and I have MS too. But that's I don't really let that affect me, and I don't really tell any people that. It's whatever.
You keep that well managed.
Yeah, on taking Tysabri.
Yeah,
it's a pretty good medication.
Once a month?
Once every 28 days.
28 days. Okay, so once every 4 weeks.
Once every 4 weeks. You got it.
All right.
Yeah.
So that'll be a exciting conversation.
Yeah.
Just to get Dr. Silverstein's insight on a lot of what we are discussing here in terms of brain nervous system. But this week, we're also going to touch on something called post-concussion syndrome.
Yeah.
So there's a lot to understand about this, and we'll kind of end up at what I feel like is the biggest point. But first of all, just what is post-concussion syndrome? So when you hear that, what do you think of? So
post means after. Concussion means, small traumatic brain injury or large traumatic brain injury. So that's exactly as you explained it. After a concussion,
sometimes those symptoms can persist. So within a concussion itself, the immediate onset of symptoms is usually from the swelling. So an impact to the head, or even a concussion without impact to the head, just whiplash, can elicit some swelling due to the shearing forces that the brain experiences. And that will cause that initial onset of confusion, lethargy, headache, all those initial things that we can detect when somebody first experiences a concussion. And then swelling starts to dissipate within a few days, couple weeks, and someone's moving through that recovery process. But the prevalence of post-concussion syndrome is actually really high. So prevalence meaning, how many people that have a concussion experience post-concussion syndrome. It's between 10 and 30% of people who have a concussion end up with post-concussion syndrome. So that's a pretty high amount. And with more recent studies in the high-risk population, so athletes, military, they're estimated to be up around 40 to 50%.
Yeah, I have that.
So my hope with discussing this is to show that if the initial concussion is not detected or treated, the chances of those symptoms perpetuating on to be debilitating months or years later on is tremendously higher. So it's not something that's just going to go away on its own. And the symptoms that go along with post-concussion might sound pretty familiar to the actual TBI of having brain fog, difficulty with memory, headaches, dizziness, fatigue, vision issues, anxiety, depression, irritability, all of those things that we've discussed on here as very common after a concussion. Imagine dealing with that entire set of symptoms for months and years after the swelling is subsided or the concussion is considered healed.
Yeah. And it changes you. It seems like it changes your personality. Actuality, it might be post-concussion syndrome.
And post-concussion syndrome is treatable.
So I could be the same dude as I was. Ange will be happy to hear that. Although I think she's used to the new one now. So.
And when we first brought this up, you said, "Do I have that?" or something to that effect. And I was like, "Well, you still have symptoms of your concussion, right?"
Yeah.
But keep in mind, he went 9 years without getting it treated. So that situation of knowing that it was never diagnosed, never treated, in an accident as traumatic as yours, like you were immediately admitted to the hospital. This is not a scenario where you were out on a soccer field or playing with your friends, fell out of a tree, hit your head, didn't want to tell anybody, and just kind of forge your way forward without wanting to say anything. This is an instance where it was immediately diagnosed and treated. Immediately diagnosed as an accident.
Yeah. Helicopter off to the emergency room.
Yeah. But it was never brought up to you that you've injured your brain. You probably need to rehab that.
Yeah, not at all. I wish they would have.
So imagine how often these concussions are essentially going under the radar. So the data we have around post-concussion syndrome, I'd argue, is relatively ill-equipped to represent how often this is prevalent in our community. So out of the people that have been diagnosed with a concussion, high-risk populations of military athletes, 40 to 50% are experiencing post-concussion. That's of the concussions that have been diagnosed and treated. So how many concussions out there that have not been?
Lots of them.
And the part that I think is really important to discuss is that the trend that's been noticed is that post-concussion syndrome is now being misdiagnosed or treated as other ailments, further separating the person from the intervention that could really help their symptoms.
For instance, maybe if a kid in, say, I don't know, 6th grade falls and hits his head, and they're like, "Oh, you're fine, you didn't pass out," or whatever. And now in 7th grade, he is diagnosed with ADHD.
Perfect example.
Yeah, could be post-concussion syndrome and not ADHD.
Exactly. So those same side effects from a concussion with difficulty concentrating, brain fog, all of those things that could have been addressed and treated if we had the most comprehensive interventions for concussions could avoid things like ADHD that's diagnosed in middle school or high school that really could just have been post-concussion.
Or anger problems. Kids get diagnosed they're told that they have anger issues. And then a lot of kids use that as an excuse to be, or, a lot of people use that excuse. Well, I have anger issues. Well, maybe we could have fixed your anger issue.
If you had your concussion treated.
Right.
So how many people are put on mood stabilizing medications? Because this was never detected. Anybody who got them to the point of treating something that we're more familiar with, such as depression or anxiety, if we had a little bit more in-depth awareness of how concussions and post-concussion symptoms can present, we might be able to avoid treating a symptom for essentially the rest of the person's life instead of getting to the right intervention at the right time.
It makes me think because Des fell when she was a little kid. She was like probably 3 years old. She was like twirling around and she fell and she hit her head on the corner of the steps. And like she got a big goose egg, like instantly it was swelled up. And we took her to the emergency room and they were just kind of like, literally, they asked, did she pass out? No. Did she throw up? No. Okay, she's fine.
The same myths we just busted a couple weeks ago.
Yeah, myth busted, doctor.
Exactly. So that's a great example of how sometimes even as a parent, you're doing the right thing, but without the healthcare side having the appropriate questions and follow-up. Now, granted, at the emergency room, we spoke about their job as a triage. Is there any signs of internal bleeding? Does she need something right away? But what if instead they said to you, follow up with the primary care doctor in about 2 to 3 weeks, keep note of if she's complaining of any headaches, if her pattern of eating changes, if she's not sleeping well, if you notice that she's more irritable, if they give you these symptoms to keep an eye out for. Because as a parent, you really have to be the detective if a kid's that young.
Yeah, oh, absolutely. Because it would be hard for somebody else to tell.
Yeah. And even, I'd say even kids up into their 20s, they really do require some sort of external detection system. So either a friend or family member that knows this person well to be able to tell if these things are evolving, because it's hard for them to take a self-inventory, especially as athletes or high achievers. They're not really going to tie those things together because they're used to just perform no matter what.
I still need somebody to tell me if I'm acting off.
Yeah?
Yeah, like, come on, Travis.
Who do you trust to do that?
I don't know.
It's hard to trust somebody to give you that insight and to take it seriously.
It is.
Because sometimes we can just push it off as they're being a little bit too sensitive.
I think Ange is a little bit, I don't know. Like she's
definitely the most capable of detecting.
Yeah.
Because she spends the most time with you.
She's very quick to tell me that something too.
Yeah.
So I'm like, and I figure like, oh, you're just irritable or whatever, because you know how she is.
Right.
She's quick.
She can tell you about yourself pretty quickly.
Yeah.
Yeah. But for kids, as we said, like they can't, it's not in their vocabulary to identify those things. And Des was 6 years old?
Probably younger than that. 2000. She was probably 3 years old.
So she probably does not have it in her vocabulary to say, I have a headache. But you might notice that she seems like she's like her head hurts, putting her head down, bracing her head, or not engaging with you as much as she normally would, or other things that would indicate she's in pain.
Yeah, and that's something that, we didn't even look for because the doctor was like, oh, did she throw up? Did she pass out? No, she's good. Okay, she's good. So we just automatically assumed that she was fine.
Right. And then if there was a behavior change that evolved shortly after, knowing what you know now, you would probably be a little bit more in tune as to like, okay, this maybe she's exposed to a little bit too much noise, stimulation, things that provoke concussion symptoms.
Yeah.
And kind of removing her from that environment and obviously getting her treated for the concussion. But a lot of times that's not how that plays out. You're told like, oh, they're fine. They didn't. I mean, even Lonnie gave us an example of how he took his daughter to the doctor because he was worried, she had a hard hit to the head, wanted to get everything checked out. And, he was wise to do so and was told everything's okay. But I think sometimes leaving with that little bit of advice of what to keep an eye out for can oftentimes get these post-concussion symptoms detected and treated appropriately instead of the person going down the route of eventually being treated for anxiety when really it's post-concussion symptoms that were never treated.
Yeah. I don't think people give hitting your head enough credit. Like most people don't know how serious that is. And the more I talk to people, the more I realize that people don't understand how serious that is.
And without understanding what could happen weeks or months down the line, without understanding the seriousness, that is what reinforces why it's something to pay more attention to. Because even probably prior to your motorcycle accident, you would expect that headache is going to be the only thing that you would have to be mindful of. If you hit your head, it's obviously not knocked out. You would just have to be like, well, if I have a headache tomorrow, this is probably what it's from. But not understanding that other things could be related to that, like being off balance, losing some of your, athletic ability if you're participating in something like that, starting to experience dizziness, all the other symptoms that could go along with that.
Man, I'll tell you, now I'm thinking about all the times I hit my head. There was one time I was out in my backyard and I was standing by my skateboard ramp. I had like a half pipe in my backyard.
When was this? Place us in time.
I was dating Tara. I was probably in 10th grade.
Oh, okay.
10th grade. High school days. And I'm standing there and I'm like.
So you were a skateboarder in high school?
Skateboarder,
okay.
Yeah. And dating this chick named Tara. I can't remember if she was there or not. But somebody was there and I had a baseball bat in my hand. And it was like not a full-size baseball bat. I think it was like a littler baseball bat.
Like when you get as like a gift at the baseball game.
It was like
it
was a metal baseball bat, maybe like a kid's,
maybe like a T-ball one or something. Okay.
Yeah, but it was pretty stout, Mm-hmm. And I said, and there was a basketball like laying on the yard, and I said, "Yo, throw me that basketball," and I swung the bat at it as hard as I could, and it bounced off, and it hit me right here, and like it was instantaneous, just blood everywhere.
Oh my
gosh.
Like
it split my eye like wide open.
Wow.
Yeah.
In 10th grade. Now, you should go back and look at your report cards. See if there was like a change in your grades.
Well,
from the before and after.
So I always did just enough.
Yeah.
Like
that was not a good measure for your
no, it wasn't a good measure. I was always like looking for adventures and stuff.
You found one.
Yeah.
Roller skating and playing basketball, baseball.
Yeah. Skateboarding.
Yeah. Wow.
Yeah.
So in skateboarding, there are a lot of collisions and impacts. And also I was watching BMX competition that was out in Utah this past weekend. They had it on TV. And all this research that we're doing with contact sport athletes and the head impacts that they experience and how it affects performance and injury risk, BMX riders take some nasty hits.
Oh, yeah, for sure.
In the 30 minutes I had it on, there were 2 severe concussions that happened. Like medics one guy was stunned for a little bit, so I'm not sure if he was awake or not. He just wasn't moving for a little bit. And another one was moving, but was clearly disoriented. And then they get back up, stagger around a little bit, and of course the medics are trying to keep them safe, and then get back on the bike, going down this extreme drop to do flips and all this, things that require so much vestibular work.
Wow.
To keep yourself steady.
And they're right in the midst of a freaking concussion.
In the middle of a concussion.
Not good.
No. So that's a whole nother.
Yeah, that's a whole nother
situation there, because gymnasts experience that too. They have some nasty impacts and get right back up and have such a high vestibular demand task in front of them.
Yeah.
But yeah, those are acute concussions, not necessarily in the post-concussion spectrum.
Right. So acute is like directly after.
Yes.
And then post is like.
Yep. So there's acute, subacute, and chronic. So acute is exactly right. Right after. Subacute would put them, kind of between, just depending on their swelling pattern, like anywhere between like 3 days and a few weeks, maybe up to 8 weeks would be the subacute. And then chronic is longer than that. But we now know that it's not chronic, it's post-concussion syndrome.
Post-concussion syndrome.
And we treat it just like a concussion.
Yeah, it's a good idea.
Isolate it, fix it.
Yeah.
Figure out what the problem is, challenge it, force the brain to work a little bit harder to get what we need out of it, so that way you're no longer in this compensatory pattern of just getting by.
Right.
Yeah.
Because that's no fun.
No. Now, how about people that are treated for migraines into their adulthood without realizing there was a concussion as the catalyst?
I'll have to ask my little brother, Justin, if he ever hit his head, because he had migraines when he was a kid, like super bad.
The other thing that I noticed is the term migraine and headache have started to become interchangeable, and that's not great, because migraines are specific to a cluster of symptoms. Oftentimes can include nausea and vomiting, partial visual field loss. It's not just a headache. But a lot of times when someone's experiencing an intense headache, they want to call it something different so that people can feel the magnitude of how bad the head hurts.
I have a migraine.
Right.
Meanwhile, they're just like...
They have a bad headache.
Yeah.
But that term migraine takes you down a whole different treatment path. There's a whole different plethora of medications for acute or right when you start to experience the migraine, that you take this medication, or long acting or preventative. That's a lot of pharmacological intervention for something that might just be the headache that's in the post-concussion spectrum.
Yeah.
So that's something that's really important if you're navigating this on your own, is know the difference between migraine and headache, because being treated for migraines, so migraines are something that happens without a source. You can just wake up and then start to get this nausea, vomiting, visual field loss, intense pain. Some people get temporary paralysis with it. That is a totally different animal than I hit my head a few weeks ago, never really did anything about it. Every time I go to try play sports or try to work on the computer, I start to get an intense headache. Very different.
Yeah, because I remember my little brother, like he would be literally laying on the couch with a bucket to throw up in, and he would be completely debilitated. There was no getting up to go do anything.
Yeah.
Like it was just like, I am dead. Like, don't say anything.
And the risk of developing migraines does increase after a concussion. However, like I said, the important factor is intense headaches doesn't equal migraine. So if you are in that category of the post-concussion syndrome folks that are trying to navigate care, call it what it is. If it is just pain in your head, even though it's very intense, call it pain in your head, so that way your doctor can kind of help navigate and get you to the right intervention in the right way.
Right, because if you're like, well, I got a migraine, they start treating you for a migraine when you don't have a migraine. That's like, let me fix your ankle when it's your knee that's really hurting.
Yeah, exactly. Now, the other component that we encounter a lot on the PT side is fibromyalgia or chronic fatigue syndrome. So those are a category of conditions where doctors kind of land on that diagnosis by exclusion. So fibromyalgia, Dr. Silverstein will know a lot about that because it kind of overlaps a little bit with MS. So fibromyalgia is when there is a hypersensitivity of nerve endings. So pain is more frequent, more pronounced, more widespread. But that, as well as chronic fatigue syndrome, which we know fatigue is a huge symptom of concussions.
Oh, yeah.
If that goes on without being treated, it can last months, years. And then you might end up getting treated for, let's say, chronic fatigue syndrome, when really you just have a concussion that was never treated. And now you're down this pathway of taking medications, doing certain interventions that are just not appropriate for what it is that your body needs.
Right. They're trying to fix your chronic fatigue, or they're trying to fix your post-concussion with chronic fatigue therapy.
Mm-hmm. Mm-hmm. And giving you medications that would be more appropriate for somebody who has chronic fatigue syndrome versus somebody who's just trying to heal from a concussion.
My mom says she has chronic fatigue. I don't know if she does.
Okay.
She says she does, though. I don't want to discount her, but I think she's just
maybe she'll look into her iron levels and things like that. See if she's anemic, or her doctor can help navigate all of that. But that important of the appropriate diagnosis really does rely on our awareness of what post-concussion symptoms can look like, what they can sound like, what they can act like, just to be able to get the person the right care at the right time. So another thing that I see occasionally, it's not as much as it used to be, is anytime somebody's dizzy, their doctor will send them with a prescription for BPPV, benign paroxysmal positional vertigo. I think we touched on this.
We did BPPV.
Just because they're complaining of dizziness?
Yeah.
But then diving a little deeper into, well, I did have a car accident. And you're like, well, tell me more about that.
Yeah.
And then their symptoms line up with more of just a vestibular disorder from a concussion, rather than that distinct room spinning anytime their head changes in relationship to gravity.
Right. And it's very hard for maybe even the patient to
tie that together.
Tie it together, yeah.
And it was never brought to their attention that these people that were in car accidents and go to the hospital, they get their neck x-rayed and maybe a CT of their abdomen, and then they're sent on their way, never with that caveat of, if these symptoms develop, notify a concussion specialist or go seek care with a concussion specialist.
Yeah.
And the part that gets me a lot of times is, if there's enough force with any impact, car accident or otherwise, if there's enough force to fracture the bones of the face, there's enough force to cause a concussion.
Oh, yeah. Because a concussion, like I said, I used to think that a concussion was when your skull bone was actually cracked. That's what I thought a concussion was. But that is not what a concussion is. A concussion is when your brain, we have this handy dandy model, when your brain, like, it rattles around in there.
Accelerates forward or decelerates. There's like, they call it a coup counter coup injury for the forward, the motion of the brain in the head. So it could even go in a rotational direction, can go forward and back, but the movement of the brain and the skull is what can cause the shearing forces for a concussion.
Like there is room in between your skull and your brain. Your brain doesn't rest like right up against your skull, you know? So there's room for it to move around in there. And when it does, like it's not really supposed to. It's kind of supposed to stay like floating in the cerebral fluid that's in there, and it's not supposed to bang up against the. It's like taking your cell phone and just banging it against the concrete.
It's like having your cell phone in a case that's too big.
Okay, I like that.
So if you were to move the case, the cell phone's going to move within it.
Yeah.
And you wouldn't love it if your cell phone was rattled around and then expected to perform, you know, its high-speed functions and all that, this computer.
And you know what? Speaking of that, like phones and computers, I figured out a perfect way to describe how it feels to have a concussion.
Yeah?
Yeah. Or how it feels to have like a TBI. Like, and I think that everybody could relate to this. Like, do you know when your computer starts to run extremely slowly and programs won't open and things just start to jitter and judder and you don't know what is causing it? You're like, why? Like, what is going on? Like, do I have too many programs open? Is there something? Like, is my internet connection right? I don't know. I don't know what's going on. But all I know is it's not running right. It's not moving like it should. It's all jacked up.
I like that.
So I have to, like, the easiest way to fix it is to fix the computer is to reboot it. Like, you reboot it. So you need to like reboot. And I think I know when I would get like still to this day where when I need to reboot, like I need to just go get to like a quiet space where there's not a lot of stimulus and I just need to sit for a few minutes and reboot. Mm-hmm. And then I can come out and I can be okay again and work normal. But
that's a perfect example of like when your phone's running slow or your computer's running slow and you're like, oh, I need to turn this off and turn it back on.
Yeah.
People can visualize what that means because they know like I clicked on this app and it's taking forever to load.
Right.
Like that's what's going on in your brain.
That's except a lot more complicated than even your phone.
Right, because you're trying to get all these apps have to run simultaneously.
Right. And yeah, that's like literally what it feels like. Like that's
a great example of what you visualize when you need to shut your phone off because it just is lagging. It feels discombobulated. It's not doing what you tell it to do.
Right.
That's what you're experiencing.
Yeah. And you just don't know what it is. You don't know why it's doing it.
I like that.
You just know something's wrong.
Right. There's no quick solution. When your computer's doing that, it's not like you have to hit a certain key and then it's all better.
Right.
You have to shut it off.
You got to shut it off.
Take all that stimulus away.
Right.
Count to 5, plug it back in.
Yeah.
That's a good analogy. I like that. Before we wrap up, one more thing that I thought of when you mentioned that you thought that concussions meant that you cracked your skull. Okay. So we should have covered this in the myth thing. I should have thought of including it there. Do helmets prevent concussions?
I certainly say if I wasn't wearing like that helmet, I would not be here right now.
So I would say that helmets prevent skull fractures. So you're correct. If you weren't wearing a helmet in your accident, you wouldn't be here.
Right.
But it likely would have been due to the damage to the skull, which would have caused far more severe damage to the brain.
Brains would have been all over the racetrack.
But right now, there is a lot of attention on Guardian caps, which are padding the helmets, and higher quality helmets, which are great for preventing skull fractures. But helmets don't slow down the head. They don't prevent whiplash.
Yeah.
If anything, they make the head heavier, make the whiplash more severe. But that is oftentimes a myth that if they want to protect the head, the thought is to put a better helmet on, but we're really just protecting against skull fractures, not protecting the way the brain accelerates within the skull like you showed.
Yeah.
So
yeah,
that's
for
another
sure.
important one there. Yeah.
Nice.
All right. Well, I'm excited to talk with Dr. Silverstein at some point soon.
Yeah. He's very much like me. Like him and I, like we're like right aligned with a lot of stuff. Like we just basically hang out.
Yeah.
Like I feel like he would be like, if he wasn't like my doctor, like we would be like hanging out and just talking about stuff.
Yeah.
Yeah, he's a pretty cool dude.
I'm sure he'll have a lot of great insight for us. And then this month we also have Dr. Schaller joining us.
Yes.
We got a lot of.
And he's with Mid-Atlantic Concussion.
Yep. Mid-Atlantic Concussion. Yep.
Yeah, and Dr. Silverstein recommended that today. He's like, hey, You should talk to
This practice, yeah.
Mid-Atlantic Concussion. They have a lot of concussion specialists. Well, guess
They're
what?
leading the way.
Yeah, I like it. Cool.
So thank you all for joining us, and we will see you next week.
Yeah, see you next week. Thank you very much. See ya.